freaked out. Today is the hardest day. The techniques that I show you on the back, you basically take the same techniques and you put them on the legs, and you'll see similar things happening around the upper head release, and then also as well on the feet too. Okay, so we always have a drape. You can use a big towel like this. You can use a fleece. You can use a tablecloth. You can get some really nice tablecloths, okay? And sometimes if you want to go that extra mile, like in my therapy room in my house, I use a lot of green and a lot of beige, so I have everything colour coordinated with, you know, my towels, everything else in the room. So you can make it all match. My old room was very dark grey and black, so the room I have just now at Duke Gym is like this. So these are my towels from Duke Gym. So again, you want to make everything look as if it matches too. Are you okay? You look really worried.
No.
Okay, so we've got the ankle slightly elevated and we have a towel here, okay, over our client, right? I'll go more into how to move your towel as the client comes on the bed. So in the first instance, before we even start to work with oil, there's a certain routine that we go through, which again makes the client feel that you are more in control of the massage and that there is more style in the massage right from the very beginning, okay? A lot of therapists go in straight away and they go 8 times this way, 6 times that way, 3 times this way. And the client knows when it's a routine. They know when it's not specific for them. So the difference is I teach you straight away from the very beginning how to make the client relevant to the body that's on there. So you should never be doing exactly the same treatment for everybody. Okay, so we do some draping. We then have no shoes on, so we're going to be with bare feet on the floor. We're then going to collect our own energy. So how we do that is we just bring our hands together. Okay, you can also use your own breath as well. And you breathe into your own hands. You then want to put one hand here on the base chakra and another hand here on the throat chakra as well. And this is you connecting with your client and saying, hello, how are you? I feel you and you feel me, okay? And you can say to your client, all right, so just taking some nice deep breaths in through the nose and big sighs out through the mouth. Just connecting with that breath and just relaxing. So that introduces you to the client. So it's the tone of your voice. It's also knowing what to say to the client. When you tell the client to connect with the breath, it centers them, right? You're sending a connection between the client and you of saying, I'm here now and we're going to work together. Okay, that's a powerful thing when somebody's coming in for the first time and they don't know you. Rather than coming in straight away and going, right, 6 times this way, 8 times that way. This is much more personal, okay, when you work like this, all right? Also, we can give a little bit of a pulse here on the base chakra. This opens up the hips. You'll see the client connecting with the breath. You'll actually see the thoracic area. See the way you can see it moving up and moving down, okay? That's what you want to be looking for. A lot of people don't know how to breathe, or they're not conscious breathers either. So see even that beginning stages where you see the breath, that's maybe the first time that that person has consciously focused on their own breath in months, or maybe they've never even done it before. So that's really the treatment beginning when we just start like that. When you're ready, take your hands off and we're going to come round and we're going to, this is called meet and greet the feet, okay? So we're coming in under both ankles here. We can pull back so we're on the pads of the feet, and you want to just gently open up the hips, okay? So we had a hand on the throat chakra and a hand on the base chakra. We use the breath. We encourage the client to breathe with us as well. So we're centering the client. Now you want to come down here, scooping under the ankles. You can shuggle and open up the hips here. He's got quite long legs and big feet, so I'm actually going to hold him here on the pads, okay? And we're just going to waken up the hips and the legs and the ankles. Again, saying, hello, I'm here, I'm in charge of this, and now we're going to work together. Okay, and he's still using the breath. We're then going to squeeze one of the pads of the feet and gently just pull it back, just to give that side of the body a nice stretch. Then releasing, squeezing the pads of the feet and pulling back again, stretching down this side. You can do that once, or you can do it twice, depending how tight it is. He feels okay. And then I'm just going to raise the feet a little bit more here, just to elevate, and I'm going to shuggle, and then I'm just going to replace the feet. Come over here so you can see what I'm doing. And then I'm just going to put double thumbs here. This is a huge acupressure point in the foot and also for the full body. So this is the solar plexus. So light to medium pressure, I'm just putting my thumb. So we have like a kind of line here that goes from the pads to the main area of the foot, right? It's here. So I'm just going to pulse there. When you do that, watch him, you just connected with his breathing there. That sends an energetic pulsation right up to the head when you do that. So that combination is a really nice way to connect with the client, settle them down, energetically introduce yourself to the client before we even start going in. Okay, Haley, do you want to give that a go there?
Mm-hmm. Oh gosh, it's cold here.
Do you want me to turn the air conditioning off? Are you okay? Okay, so it's a bit more here, it's kind of on, that's it, it's on that bone area there. So just taking some nice deep breaths, in through the nose, and big sighs out through the mouth, and just gently relaxing, and let everything go. So you see how I'm quite soothing the tone that I'm speaking to the client. Okay, all of this is so important. Again, in the beginning when I was first starting, I wasn't taught how to talk like this. And I was, because I was so like, I really want to do this, I really want to get it right, and I was dead fired up, right? I was very kind of sergeant majorly with the clients. I'd be, right, now we're going to be breathing in through the nose and out through the mouth, come with me. You know, and I realised that the way that I was being wasn't the correct way. So again, we need to be beacons of light, very soothing, very reassuring. So the tone of your voice as well is very important, as well as the words that we use. Always kind, always caring, always nurturing. Okay. Alright, so taking both hands off at the same time, coming around. We're going to be scooping under the ankles. This is called meeting and greeting the feet. Yeah, that's it, taking it down. And we're going to shuggle. So when we're shuggling, what are we doing here, Alex? Why do we shuggle? What are we doing? This is it. Good, yeah. So we're connecting now, okay? We've done our connection here. We're now meeting and greeting the feet. And we're shuggling, we're opening up the lovely hip area, coming down into the legs. And again, we're saying, hello, I'm here, I'm connecting with you. So once we've shuggled, we're then going to take one of the pads of the feet, you're going to squeeze it and gently just pull it back. So you squeeze first and then you pull and then you release. So keep holding them up at the same time. That's it. And this one here, you're coming onto the pad now, squeezing and then gently just pulling. So again, you're stretching that out, you're wakening it up. And you would do this how many times, Hannah?
Twice.
You can do it maximum twice, yeah? Once, or if you want to go in, give it a bit more movement, twice is fine. Well done.
Your hand sliding down, or is it just
You squeeze the pads, and then you're
You
pulling.
have to have quite a good grip because your hands will.
He's got quite a big face,
Yeah.
yeah.
when you pull, is your hand sliding, or is it just hold?
You're supposed to just hold.
You're supposed to just hold it.
No, you're squeezing the pad, and then you're pulling the pad back. You're not allowing your hand to
Not
slide.
slide.
Yeah. So once we've replaced the feet, we then do double
Acupressure.
thumbs into the solar plexus area. These are acupressure points. That's it. Good. And again, what type of pressure do we use there, Alex? Light to medium. Just light to medium. You see, if we go in too deep, it's too sharp for the client. The pads of the feet are really sensitive. So it's only gentle. again in the beginning, soft, nurturing kind. You don't want to go in too fast because then they'll jump and they'll get their guard up and they'll be like, oh God, this is going to be difficult. Okay, so it's like you're kind of creeping your way into their system.
And see, now I feel like I'm pressing here, but are these fingers, I don't want to be squeezing his foot like the,
Yeah, you can even just let the feet come down, right? And even,
just press.
yeah, it's just like a kind of gentle press. Again, when you do this, it will send an energetic signal right up to the head, okay? Alright, okay. Hannah, do you want to give that a go?
I'm sorry, my hands are cold.
So you're doing the right thing there. If you have got cold hands, heat them up first, okay? Before you would start with your where you're working through a towel, so they won't be able to feel it. That's it. So it's at the same time, okay? So you want to warm up the hands, okay, and then breathe into your own hands. You're taking your own energy, and then at the same time, it's coming down.
So, nice deep breath in through your nose, out through your mouth.
And just completely relaxing and let everything go. And again, you need to use your intuition at this stage, right? Of how long does this go on for? Okay, you need to have your own good third eye here. Where is this client? There's some clients I do this really fast and I'm straight onto the feet. There's other clients where I'm like, okay, they've had a lot going on. Just spend a few more seconds pulsing them. Again, it's different. You need to see everybody differently. Okay, so you're focusing on them. Good. Okay, now meet and greet the feet. Good. That's it. Good. How does that feel? Okay?
Yeah.
All right, Alex. So keeping the neck hand still, but that's the correct positioning, and then pulsing the hips. Okay? The hips and the belly are the center part of everything above and everything below. Okay, so you want to just again rock that a little bit.
Taking some nice deep breaths in and out.
That's a good height and good positioning. Yep. Good. Excellent. Good. Okay. So when we're doing this prep work, okay, you're tuning in with the client. Even the shuggling of the hips, what side is tighter? Where does it feel tight? Okay, pick up the information. How are they? when you're working with here as well, how are they connecting with you? How's the breathing going? Okay, so we're reading the client, we're getting information, what they're actually like, where the tension is. You'll have done your client consultation form with them anyway, so they're going to have told you at this point, oh, I've got a really sore shoulder, or my lower back's killing me, but it allows you to assess more postural imbalances, also muscle tension in the body. So then we want to bring the towel down, and when we do this, we work from here. So it's a bit like draping of the client, right? It's not this, right? Okay, again, it's your care, your thought that goes into it, okay? So this is a much nicer experience for the client, okay? And again, it sends them the signal that they've been looked after properly. Now, with Holistic Full Body Diploma, can you loosen your shorts a little bit for us there? Or are they haven't got a strap on them? Okay, now, you can have, some therapists work like this, okay, where the towel is here, it just comes to the lower part of the spine. But with what I show you is I also show you how to release the glute medius and the top part of the hips. So it's absolutely fine to bring the towel to here, okay? And then you've got to make sure that the towel is also tucked in around about both sides, because as you start to work with the client, the towel will become loose. Okay, so here, this is the glute medius area, okay? And we're working here over the iliac crest and the hips. So we need to have this, because this, if this is tight, it affects everything that's going on here. So this is our correct draping. This is what this is called, the correct draping for the client. Now we're going to go into now what's called our dry work. So again, even before, we've not even got any oil, because I want more information about where the tension is, what's going on with the client, right? So this is called dry work. It's also called myofascial release as well. And again, it sends that signal to the client of that you really do know what you're doing. You're not just going in straight away and working with oil. So we want to assess this part. This part of the body all belongs together, and this part all belongs together too. So I want to look at what's happening here on the other side. So I'm going to put one hand here just to protect the client, balance the client too. And like with you being a pilot, you'll know this, right? I call this the aeroplane, right? So with your other hand, how to assess the shoulder is you're bringing the hand in here over the top traps. Then with your fingers, you're pulling up. And then with your pad part of your thumb, you're squeezing and you're pushing down, okay? So you're effectively lifting the top traps up and you're squeezing and you're pulling it down. That allows you to feel how tight that muscle tissue is, and he's quite tight there. So that's step one. How tight is that shoulder? Yes, it's tight. I don't need to do it again. I know it's tight. If you're not sure, again, you can go in maximum twice. Okay, if you really want to know, keep your arm nice and straight and push into it. Okay, but he is, and he's that tight, it's all locked in. Up here, you can see it's slightly raised. Again, visually look at the client, okay, you can see more about what's going on with them. So you can see there's not much area here. Now we want to assess coming down the side of the spine. So you've got connective tissue here that comes all the way down here. We've also got more connective tissue that comes in here as well. So we want to assess how tight this area is. So we're going to get digital fingers and we're doing circles. Excuse me, all the way down the spine. So typically he's tight here and he's really tight all the way here. He's also very tight here in his midsection too. And then it kind of loosens off a bit as we come into the hips. So this starts to feel looser. You will not understand in the beginning how to do this, but you see as the week goes on, you will develop a better understanding of what tight muscle feels like, because you'll all be working on each other and you've all got different levels of tension. So don't worry if you think, I don't have a clue what she's talking about. How tight is this muscle? You will develop this knowledge as we go on. In the beginning, just copy what I'm doing, let it sink in. We then want to assess as well, coming down the side of the hips here. So we do double thumbs over the hips. If the person's really large, okay, and you've got a larger space, or maybe you want to focus on the upper area of the body. To save time, because it takes longer to double thumb strip, you can also hold here on the other side of the spine, and again, you're just coming in with another aeroplane palm movement to squeeze it out, but he's really not too tight here. It's all here and it's all upper body. Okay. So again, you're collecting the information. Where is he tight? Where is he holding the tension? I need to know this because I need to give this person a treatment that's focused on where their tension is. And then you just come around the other side. Again, place your hand here and squeeze in. So I'm trying to assess now which shoulder is tighter than the other one because they're both pretty tight. See the way he's quite hunched over as well? Okay. And then again, how are these hips? Okay, straight away, this is tighter than this, right? So I now know when I'm working on him that this hip has more problems than this hip. It's tighter. You should feel the difference there because it's quite significant. Yeah, and he's also tighter here as well.
Is it just me or is that more raised up there as well?
Yeah, no, you're
On that
correct.
side.
Yeah, so well done. That was very well done to observe that. Okay, so he's tighter here too. Okay, again, he's also very tight here on top of the scapular area. So you get different muscle tissue that sits on top there, right? So at the moment, just from doing this myofascial release techniques, I know that this is tighter than here. I know that this here is slightly tighter than this side, but I don't know actually at the moment what shoulder is tighter. So now I'm going to stand here at the top of the head. All the muscle tissue from here and here connects into the neck area. So we're going to be assessing the neck and how tight the neck is because I really want to know what side is tighter, or is it really both the same? Hardly ever will you get a shoulder or neck area that's the same. You've generally always got one side that's tighter than the other. The timing you will hopefully get it the same. As if that client comes every week for a massage and you've done a good job as a massage therapist, then they should be balanced, okay? So we get double thumbs here at the base of the cervical spine. Come in if you can't see this. We're then dragging the double thumbs up here to the occipital ridge, or we can call it the hairline. And then we're dragging the thumbs over. The connective tissue comes in here through slots and it goes into the brain. Okay, so straight away, this side is tighter than this side, right? Visually, you can see here that he's really tight, and also this is tight, but this side is even more raised. If you stand behind me, you'll see this. Come and stand behind me. All right. Put your head down. Put your head down.
Okay.
Yeah, that's fine. So you see how this side here is slightly raised? Okay, but they're both pretty short. When you've worked on him, all that should relax. So the information I've got here in the neck is that this side is tighter than this side at the moment. Okay, come back. Now we're going to be here. Okay, so now we're going in to the bottom of the cervical spine with double thumbs, and I'm dragging the thumbs over the top traps till we hit the scapula area, which is the big bone that comes in around here, okay? And he's so knotted, you're going to feel lumps, okay? So when the muscle gets really tight, it forms lumps under the skin. So typically, he's all knotted here under the scapula, so this is why both the shoulders are pretty bad. Yeah, this shoulder here has definitely got a bit more going on than this shoulder. So I needed to also do this myofascial technique from this side to really get that information of where the tension is. You see how here he's going a bit red? Okay, this is an indication again of how tight he is, even with me just dragging my thumbs here, right? What's happening is as you're pushing into the muscle tissue, as that happens, it's allowing the blood now to bring you oxygen into that tight muscle. So if you see this, there's nothing wrong. It basically means that the muscle's already relaxing, the blood is now flooding into the muscle tissue, and it's bringing new oxygen areas to the muscle. Okay, so you do your double thumbs to here, you come to the bottom of the shoulder area. Now you don't do double thumbs like this over the ribs, because we've kind of done that. What we want to assess here, this is called the erector spinae, coming into as well to the quadrus lumboreus. So what we want to do is double thumbs coming down
Sounds like a dinosaur.
Oh, it's ridiculous. Yeah. Call it the midsection. Call it the midsection. I don't like to bog people down in the old Italian names, okay? So we can call it the lateral line, we can call it the midsection, we can call it much easier things to do. The main thing is that you get the practical when you're here. All the other stuff you can develop, when you do your anatomy, physiology studies, etc. Okay, so you want to do double thumbs coming down. Yeah, and to be honest, it feels pretty much the same here, but we knew when we were standing on this side that this area here, as we were pushing, let's get slightly more on it. Okay, right, I want you guys now, Hayley, you can kick off. I want you to be here and to do your assessment like this and see if you agree with me about where the tension is.
Would this have anything to do with someone being left-handed or right, like the way that they carry the?
It's your body mechanics, right? So basically, it's everything to do with being left-handed, right-handed, holding the mobile phone, how you sit when you're on the computer. Are you driving the car for many hours every day? Are you a professional coach? Have you been flying an aeroplane? You look at what that person does every day, what their body mechanics are. Again, when you do your client consultation form, you get a lot of information about them, okay? But specifically, if the client says, my neck and shoulders are absolutely killing me, just please sort it out, then this is a good way to know, okay, he said his neck and shoulders is killing me, but he's not giving me any more information. This is giving you the information of it's coming from that side of the neck. This shoulder's more affected than this shoulder, okay?
It's full of knots.
Yeah.
Sure.
That's good, so you already know what knots feel like, yeah?
Yeah.
And
Yeah.
his hand, does it matter where he places his arms?
In the beginning, I like to have the clients with their arms hanging off the side of the bed because it opens up the chest area. Once we start to work with the client, this is also the loose way for the muscle to be sitting. If we bring the arms back, it tightens the muscle tissue here. So it's better in the beginning to have them off. As you start to work, apply the techniques, loosens, you'll find out more where the trigger points are, adhesions, knots. Once you start to identify that, as it loosens, you want to go in a bit deeper, then bring the arm back, it tightens it, then you go in, repeat with technique and also sequencing. But that was a good question, well done. There are
Because
therapists.
sometimes when I leave my hands there, getting a massage, I get really, like the blood flow.
Yeah.
and I
Yeah, I
get
start to
cold
get
and
pins and needles.
Yeah. By all means, like I'm always moving my clients around, right? You move your client around, or if your client needs to move around, there's no problem, because as we are in charge of the treatment, we'll soon move them. So you could have one arm back if they do have problems with circulation and blood flow. If it's easier for them to have their arms back, that's absolutely fine. If you need to open up the shoulder joint, then you can move it, but then replace the arm back. If there are no problems, as a general rule, start like this.
I was just, would I still be able to come in with the aeroplane now, just so I could feel?
No.
You always have to do that first.
Yeah, always do one side, your aeroplane, your digital fingers coming down the side of the spine, and then your thumb stripping, or the flat aeroplane coming down to get the tension. And have that as a kind of set, this is the correct techniques for standing on this side of the body, okay? What you can do is if you're not sure, you can come back around to that side of the bed and do the aeroplane then. If you want to go back in and check, there's nothing wrong, but you don't do it from that side.
So this part would be the only part that I would be worried about, because I'm scared that I'm going to press something that's not.
Okay, so you just need light to medium pressure, okay, and you're coming here over the hairline, because all these muscles come into attachments here, which go into the brain. So you can feel just with light to medium pressure what side is tighter. It's certainly not anything that's too deep. Right, so you do here where we assess the
Down.
shoulders, and then past the shoulders you're here. So you've got both thumbs, and then you're coming down the other side of the spine. You also need to cut your nails, Hayley, when you're working with massage. Like, I've brought nail clippers with me today.
I filed them all the way down as well. Like, I need to get them off, to be honest.
Yeah, so just be careful if you need them for your work, that you're not putting your nails in.
Yeah.
I mean, it looks fine, but generally, unfortunately, your nails need to be like this to be a massage therapist. Okay, I have seen other girls here that are massage therapists and they need to have long nails too. Maybe they've got another job or whatever, but it's generally better to have it like that. Okay, all right, who wants to go next? And it's this side, so you're on the opposite side, so that was fine. Yeah, you're there. And
That's
then
good.
yeah, so you're going to be assessing this shoulder.
Okay.
Yeah. And then squeezing it down. Yeah.
Just jumping in my hand.
Yeah. So it's really uncomfortable because it's so locked in. It's
Yeah.
difficult to get a grip of it. Stay there. Okay, and then you want to be doing your digital circles coming all the way. See that wires, watch out for wiry effects. This is where we know it's tight as well.
That's not too bad. Just this shoulder here.
Yeah, you can really feel it. Okay. Did you do you can do double thumbs, yeah? Try some of that. So you want to come right here onto the glute medius, right? And double thumb it down. Again, you're just squeezing into the muscle tissue because we want the information of how tight is this compared to the other side.
Why do we do this without oil? Like, does it cause friction to the skin?
Yeah, basically with the oil you'll start to slide all over the place. So we want to get a good grip of the muscle tissue to get some traction so that we can feel it. Yeah, sure. Yep. Good. That's really good that you're identifying that. Excellent.
Feel something here too.
Okay.
Honestly, I can't feel it in here.
Okay.
But I can feel all of those other ones. I just can't feel this one.
No problem, that's okay. As you get more experience, you'll be able to identify, because this is really obvious where the tension is. This isn't so obvious, but it's when you have hands on lots of bodies, this is why you need to do your case studies, that you do develop an understanding, a deeper understanding of slight differences in tension. Okay, so come up to the top here.
How many times do we do this?
You can do it once or twice. So you want to
can't feel
start,
it.
yeah.
Yeah.
You can't feel it, okay, don't worry about it, right? So we're here, right? Yeah. So come slightly more in. So I'm like pressing like that on there. And you can feel it there. And then you're here right on the top of the top traps, okay? You've got your arms straight, okay? You're then pushing into it as well. And then coming down with your thumbs down either side of the spine. thumbs like this, not like this. So at this
This?
point, yeah.
Okay.
So you're in here. So we're assessing, right, from the spine, coming over until we hit the bone, which is the scapula area there. So we've got the levator scapulae, we've got the top traps, we've got the mid traps, we've got the rhomboid area, all in that section, okay? And they sit in different ways as well. Okay, can
Yeah.
you feel?
I can feel it on this side up in here.
Yeah?
Yeah.
Okay.
But I still can't feel it in the neck.
Don't worry about it. Can you feel around the shoulder how it's all tight and
Tight,
locked
crunchy,
in?
yeah.
Yeah,
Yeah.
good, okay. Do you want to give that a go now? Okay.
So I'm only using this part to push down. Back,
Yes, that's right. Yeah, you're using here on the thumb to squeeze and push down. You'll all be working with each other as the week goes on, so his shoulders are really crunched in and tight, whereas, you know, Alex's shoulders are going to feel different to Hannah's, it's going to feel different to Hayley's. So, again,
Let's work with these.
flung in at the deep end
everyone's
here, yeah.
favorite. The IT vans are the masterpiece.
Good, okay.
It's quite off
Yeah.
the shoulders.
Okay, so we're here, so your double thumbs are there, just at the base of the cervical spine. Yeah, his shoulders are very off, yeah. Good.
I was panicking that I'm going to be pulling the hair. And, you know, I don't think I can feel like we're trying to do it to myself. I was scared it was going to be painful.
If you're applying too much pressure onto the client, they'll jump or you'll see them take a sharp breath. If this happens, don't worry about it, just pull back, okay?
So actually pushing in to the scaps first with our thumbs and then
So be a little bit more here and then coming out, straighten your arms up. That's it, good, okay. But your lunging stance was correct, that's good. Yeah, you can really take your time and push into that if you want to get the information again of where is it really bad. So this, even though it takes a bit of time to teach you how to do this, you'll whip through this in about 30-40 seconds, right? But this is so important to then craft the massage.
So this is generally still the assessment of...
Yes, this is it. This is prepping, and this is getting the information, and then we're going to start to work with the oil and applying the techniques to start bringing the body into a better state of loosening. We're going to start treating the muscle for where it's tight. So we need to know about time frames as well. There's no point spending 5 minutes working on a section that we know another section is really holding. Okay? Good. Okay, what did you feel?
Basically, I feel the knots quite a lot.
You can feel
here,
knots, yeah?
both sides,
Yeah,
and this is tighter.
yeah.
But I also felt like somewhere here it's tight.
Yeah.
as well.
Alright, so basically, here, where you feel lumps, right? Lumps are called knots, they're also called trigger points, and they're also called adhesions, right? It's just different words for the same thing, right? So knots are where the muscle has become so tight, right, that there are proteins in the muscle that attach onto other proteins, right? And they create these kind of knot-like effects. So they kind of grab onto each other. So it's where it's become very, very constricted. All right. So again, you would look: is he a surfer? Is he a tennis player? Is he sitting working at a desk? Is he a long-distance lorry driver? What's causing this? Right. You need to know this information. Also, if the client's coming and they expect you to fix something like this in one session, you can certainly help them. Something that's as deep as that will need a few sessions. There's no way you can fix that in just one session. So again, you need to get more experience about, well, how tight is it? How can I really release this to give them a good experience? It's also explaining to the client afterwards, wow, that left shoulder was holding really tight. You're going to be feeling a bit better from what we've done today. But I think it would be good if you came in next week, because we're going to have, if you really want me to help bring that into a better state of looseness, we're going to keep working with this to get it really right. It's impossible just to get all this done in 1 hour. You need to tell them what's going on with them as well. Okay, and they're fine to hear about it, they just want to be out of pain. Right, so once you've done this, we've then got the information of where the tension is, and you've all got it, right? This part of the neck here is tighter than here, but it is tight here, but this is worse. This shoulder is worse than this shoulder, and certainly this area here is holding a little bit more than this area here, right? So we always start by treating the back as a whole, right? But then, in order to craft the massage, we're going to split the back into 4 different sections, right? So we always have 4 different areas here. Now generally you have about an hour of a treatment. 9 times out of 10 people, they want to come and see you for an hour. Okay, so we need to know time-wise, and also we need to know how to give them an effective treatment as well. How am I going to spend the next hour, right? And again, it's not just about going, okay, 6 times this way, 8 times that way, 3 times that way. We do need a bit of a routine, that's fine, but we also need to know how to make that routine make sense for where the tension is. So this is why we need to do this, right? So we want to go straight to where the worst section of the body was, right? Where was the most section in each of these 4 areas here? Where was the worst one, Alex?
Left shoulder.
Yeah, so we want to call this section 1, right? So after we've treated the back as a whole, we've heated the whole thing up, okay? Got a blood flow going. We're then going to come into section 1. After we've worked on section 1, which is the worst section of the body for tension, we then want to go to the next section to break that down. Where would that be, Hayley? Right, okay. We could go there, right? For me, I would go to section 2, because I feel that this is worse than this, right? Just slightly, right? You could though, if the client said to you, and they came in and they went, my left neck and shoulder's killing me, and my right hip's killing me. At that point, you listen to what they're telling you, and you go, okay, they want me to fix this, and they want me to fix this. So at that point, you'd be then section 1, section 2, right? Give them what it is that they ask for, okay? Even if you're going, well, I know that section there's an absolute mess. He's told me, I've got an hour, I need to do this. They'll come back again, all right? Generally though, this is really bad here, right? So you want to put this in section 2, right? So then you've worked here, you've worked here. We then want to go on to the next section that was really tight. Hannah, where would that be now? Yeah, okay. So this here is the next section that you would release, and then also this is the best section. Okay, so now we've got an idea of how you're going to tailor this massage, right? So let's start working with heating the body up as a whole. So you want to get enough oil, not absolutely loads of oil, because it's better to just have enough. Get the body heated up rather than having way too much oil. There's oil all over the place and you're slipping all over the place. You can add more oil as you go along. Okay, so I've got some oil here. Again, you want to heat it up in your hands, and then you're placing 2 hands here on either side of the shoulder. I'm in a lunging stance and I've got my arms straight. And we're coming down either sides of the spine, coming over the hips, not applying any pressure on the way back, coming over the shoulders, and you can bring it down here to the elbows, bringing it back and finishing here at the hairline. Right, can you see that he's covered in goosebumps already? Right, when you see that happening with the client, it means that already the client is starting to release. It means that you're doing a good job with the client. So he's actually, we know these shoulders here are really tight, but he's also been carrying an awful lot of mental and emotional stress as well. When you see this happening with the goosebumps, it means that already that client is feeling the benefit. You've just literally just put your hands on it. So again, don't think that you're doing anything wrong. It's not, it means that this person's carrying an awful lot of mental and emotional tension. Okay, any ideas as a warm-up how many times we would do this? This is called full effleurage.
8.
6 to 8.
Yes, 6 to 8 times. So you guys have been watching the videos then.
We have been doing our
Yeah.
homework.
So it's this type of thing that really helps you before you come to classes to have a general idea. So you want to do this 6 to 8 times. And again, you're applying the oil, okay? I'm also picking up tension, picking up information, because you can get a bit more happening. Because you've got a bit of oil now, you can pick up more about exactly where is the tension, what's going on. Okay, 6 to 8 times. Now we're going to heat up the neck. Okay, so I need a little bit more oil here. Alright, so we're heating up the neck, we're greeting the neck, starting to loosen off. We also know the right side of the neck's holding a little bit more than the left. And this is called loose knuckles. Okay? So, loose knuckles look like this. Okay? The pressure is here and you're loose knuckling down, right? You're not then applying pressure on the way back up. You're basically just keeping contact and you're loose knuckling down. So you're pushing the muscle tissue away from the spine and it's coming down. So we're heating up the neck. As the neck loosens, right, underneath the muscle tissue there's like a big fabric that's called fascia that connects all the different muscles together. So as you start to loosen here, the fascia tissue will start to send signals to the shoulders, the arms, the thoracic area of the back to say this is loosening. So the undercurrent will start to loosen throughout the body as well. Okay, so we have loose knuckles. We can also as well transition to a different technique, and this is called single-handed picking up. We can now transition to a deeper movement, and this is called double-handed picking up. So you're passing the muscle tissue between each part of the finger and the thumbs. So these are the 3 techniques we have: loose knuckles, single-handed picking up, double-handed picking up, to introduce the oil to the neck. Thank you. And you can combine that. You can use just one, or you can use all of them. Deep breaths, Victor, just connecting with that breath. So always encouraging the clients with the breath as well. Okay, and again bringing it out there, taking your hands away. Now, as you've loosened the neck, you then want to go into the shoulders. Because he's so crunched up, a great way to start with shoulders with everybody is actually to come in with loose knuckles. But because he's so crunched up this side, loose knuckles might not be available for you. It can be very difficult if you've got people with crunchy shoulders or even big bodybuilders with massive traps, right? So you need to feel it out. And again, pick what technique is appropriate for this client. Can this work? And it actually feels to be okay. And I've got quite big hands for a woman too. Okay? So we're heating up the shoulders by this is loose fisting. Okay? So loose fisting is when we rotate the fists. Alright? And now we can transition to either loose fisting down either side of the spine to heat it up, or what we can do is to use digital thumb circles here to come in between the shoulder blades. Remember how it was all nasty and crunchy in here? This allows us to get a bit more focused with the muscle treatment, and we can work with digital thumb circles here all the way through the shoulder blade, the scapula area, so you can work up, and you can also come back again. As it starts to loosen, you'll identify, like you can feel it, as it loosens, it will start to move. So I can already feel him starting to respond to just what I'm doing here, okay? You can also as well do thumb stripping. Now we did this with your myofascial technique, where we were pressing in and we were opening. You can also do this movement as well with oil. You're pressing in and you're opening. You're pressing in and you're opening. You can get a little bit deeper into the movement because you've actually got some oil now. You were asking something about this earlier on. So not only can you do thumb circles, but you can also work horizontally here as well. Take it back, transition, okay? You can push, now that you've worked it with your thumb circles and your thumb stripping, you can push it out a little bit more with your thumb circles. And just encourage those shoulder blades just to open up. And again, transition and bring it down and give it some love. Okay, mobilize the shoulders. You see the way I just gave it a little bit of a shuggle there. As the muscle tissue releases, the joints will start to open up. As it opens, it's okay to kind of shuggle it to encourage it to move up. And again, you want to finish with effleurage 6 to 8 times. Okay, right. Who wants to work with Victor today? Haley?
Yeah.
Okay, Haley, you come and work with Victor. I'll leave that on. You guys work together. Decide who's going to be a body and who's going to practice, and then after lunch you'll swap over and somebody else will be a body and somebody will practice. Bring your bed down here. So who would like to be a body and who would like to practice? Who wants to go first?
Do you have any preference? No.
Okay.
I'll be the body. Okay.
You be the body? Okay, so where's your bed? Bring your bed down. Yeah, just drag it down. That's fine, yeah. So pull it over a little bit because you're going to be working next to each other. That's it. Right.
Are you alive?
Yes, yes. In trance.
All right. So yeah, if you just get
It's
an
not
extra
more
fleece,
comfortable, but here.
there you go. So there's a fleece for her. And so we'll turn our backs. Just you come down to your shorts, pop your top off. You also need to create a face hold for her here, so she can go face down. You okay?
Yes, yes, thank you.
All right. Would you like any extra
Do you want the towel?
Yes,
towel
I think it's better. Yeah.
around here? All right.
So I use this one.
Yeah, there's some little hand towels there. That's fine. Yeah, you can put some hand towels around it. So what I normally do is, if we just use the black one, so just put one there, and then another one. Yeah. There you go. Okay.
Thank you.
So basically, you guys now are going to be working in pairs, and I'm going to start coaching you on now the techniques, a little bit of routine, how to understand what muscle tension feels like, how to release knots, and again, this is just the beginning stages of prepping up. Okay. Alright, so if you just want to pop your top and your bra off and go face down, we'll turn our backs. Well done, Haley. I never thought of that yet. Okay, all right. So just drape your client there, Alex. Okay, we'll just turn that off just now, just for a second.